Hi, my name is Vishant, and I'm gonna be doing cardiac exam. This is my friend again, Alonzo, and he'll be my patient today. Hi, Alonzo. My name is Vishant, and I'll do a cardiac exam on you today. Okay?
Nice to meet you, Vishant.
Okay. Thank you. So first, I'm gonna have my patient sit up and auscultate. So I'll auscultate like in 5 areas. I'm auscultating for the aortic, pulmonic, the Erb's point, the mitral, and the sorry, you know, sorry, aortic, pulmonic, Erb's point, tricuspid, and then the mitral valve. Okay, so basically, I'm looking for any murmurs, the rate rhythm. When I auscultate. So I'll be auscultating first with my diaphragm, and then I'll go back and do with the bell. Okay. La aortic, pulmonic, Erb's point, and the mitral valve. And then now I'll go with the bell. Mitral, tricuspid, Erb's point, pulmonic, and aortic. Okay. And I don't know if I explained earlier, the aortic is on the second second space in the second lateral in the sternum area. The pulmonic is on the right side. Aortic is on the left side. The pulmonic is on the left side, second lateral sternum side, and you have the Erb point, which is on the third intercostal space on the patient's left side, and then you have the tricuspid is on the fourth intercostal space, along the sternum, and the mitral valve will be on the mid clavicular line on the fifth intercostal space. Okay, so that was our auscultation, and also if you cannot hear properly, or if you hear some murmur, whatever, you can tell the patient to lean forward, and then you auscultate. What that does is it amplifies the sound of any murmur, or any weird sounds that you hear. So in this case, we're not going to do that. Okay, now we're going to improvise a 45-degree. This is a city library, so we're going to improvise for the 45-degree. Perfect. What I'll do first is I'm going to be inspecting the jugular venous and distension. So have a look on the left side. So what I'm doing is I'm inspecting for that jugular vein distension. I do see this is the sternocleidomastoid, and I do see the internal jugular vein going up. There are some difference between the internal jugular and the carotid artery. You can see that carotid arteries are normally palpable, whereas the internal jugular, it's not palpable, and if you try to palpate, it actually dies. Carotid arteries, they are not affected by the respiration, but in the patient, for the internal jugular, the rate depends on the patient's breathing in and out. So those are some key differences when you look at the carotid and the jugular vein distension. So what I'm going to do is I'm gonna check his jugular vein distension. Look on the right side. I see that. So I put one scale on the angle of Louis right here, and I'm measuring the one upper limit of what I'm seeing in the jugular vein. So I'll put this, and so this is upper is right here. And it's, so, I measured from the upper limit of where I can see the pulse, and then and I'll put a vertical ruler against the angle of fluid, and I measure the height. So his height was 1 centimeter, and that's, normal. The height should be less than, 4 centimeter. Once I'm done with that, now I'm gonna palpate the PMI. The PMI you'll find the most you can palpate is on his mid-clavicular fifth intercostal space. So I'm just gonna palpate with my 3 or 4 fingers. Okay, I can feel it. You're supposed to feel like a gentle, palpable pulse, and the normal is within a 1 centimeter. That's what you're supposed to, palpate. Okay, so once I'm done with that, then I can also palpate for the thrills. Thrill is like you can check the thrills mostly in the second and third, intercostal space along the sternum. So what I can do is feel for the pulse. Feel for the thrill, and you're not supposed to feel the thrill, because that means like his aortic valve or stenotic or a pulmonary valves are like stenotic. So you're not supposed to feel the thrill in those areas. And what I'm also going to do is hepatojugular reflex. What that is basically is I'm going to push against his right costal margins and see that if there is a bulge in his jugular vein. Okay, and if that is, then it's a positive hepatic reflux. So look on the right. Okay, and I don't see that, so which is good. Okay, once I'm done with the palpation, now I want to do the auscultation again of his, the same thing that I explained, aortic pulmonic herbs. Then I'm going to go to tricuspid and the mitral valve. Aortic, pulmonic, herbs point, tricuspid, and mitral valve. And then I'm going to go with the bell again. Go back, tricuspid, herbs point, pulmonic, and aortic. Okay. And again, if I hear any sound, just to confirm, what I'll do is I'll put my patient on the left lateral side. That just brings the heart closer to the chest wall. Then I can hear them more clearly. And once I'm done with that, I'm also gonna auscultate for the carotid, the bruit. Okay, you're not supposed to hear that again. Okay, if you hear any bruit in the carotid, that just means that there's a coronary artery. Sorry, not coronary artery, but there's some occlusion in the carotid artery. So just and then for the carotid artery, the best is to go with the bell and have the patient say, tell them to stop breathing, and then hear for the sound. Okay, next. Hold your breath. Okay, I didn't hear any carotid bruit, and then Okay, you're good. There's no, I mean, you you don't have karate do yet. Sorry. And now, I'm done with my part. Now, what I'm gonna do is I'm gonna do his physical examination of the peripheral. So first, I'm gonna inspect his upper arms. Make sure there's no edema. There's no hair loss on one side and not on the other side. Check for cyanosis. Check for clubbing of the finger. That just means when you see clubbing, that just means hypoxia. Or the cyanosis, you can just do a quick cap refill. Less than 3 seconds is pretty good. Then I'm gonna inspect his lower extremities for any hair loss, any. You don't have any hair loss. That's good. So no hair loss. Make sure that the skin color is good, and I can. So now after I check with that, now I want to palpate his radial arteries. Check for the brachial. Check for the femoral. Okay, bend your knees. Check the popliteal. On the feet, I'm gonna check for the dorsalis pedis. And then posterior tibialis. Okay. And also I'm gonna palpate on his lower arm extremities for any edema. Make sure that you check the temperature. Yeah, looks good, warm, and everything. Okay, do you have any questions?
No, sir.
Okay, I think we're good. We did everything. Okay, thank you, Alonzo.